Enlarged prostate or benign hypertrophy of the prostate is a very common condition. A lot of people, even younger patient from 30-35 years will come to us in our OPD with an ultrasound report যে prostate টো ডাঙৰ হৈ গৈছে মোৰ prostate ওলাইছে ultrasound so when you look in this report you'll find it is either grade 1 prostate or maybe just above the normal size of the prostate which for an adult patient is around 18 to 20 gram 18 to 20 gram normal size prostate বুলি আমি ধৰো তাতকে অলপ যদি ডাঙৰ হলেও 22 গ্রাম 25 গ্রাম হলেও grade 1 বুলি ultrasound দি দিয়ে and patient is really worried that he has developed something of a problem and আমাৰ ওচৰত আহে so let us discuss enlarged prostate today মই Dr. Brojen Barman, consultant urologist and kidney transplant surgeon মই হেলথ চিটিত কাম কৰো গুৱাহাটী And the thing is, the prostate at a normal organ. So, মতামানুহে prostate থাকে. For a normal adult, the size of the prostate is around 18 to 20 gram. And so, what is prostate? Prostate or pathologically, I mean, benign prostatic hyperplasia. Will you call it benign prostatic hyperplasia or BPH? Very common in histological workup. In older men, it is a very common entity. Prostate to lahe lahe olop size bari jay. Jodi ami biopsy kori sao, pathologically sao je significant number of elderly male, usually people who are older than 50 years, will have pathological evidence of enlarged prostate, which is called the benign prostatic hyperplasia. So enlarged prostate hole ki hobo? পেচাবৰ কিছুমান প্ৰব্লেম হ'ব এই গ্ৰুপ অফ চিমটমছ বিলাকক আমি LUTS বুলি কওঁ LUTS that is LUTS lower urinary tract symptoms I'll make another presentation discussing lower urinary tract symptoms কি হয় basically যদি বাৰে বাৰে পেচাব লাগে পেচাব ৰখাব দিগদাৰি পায় পেচাবৰ ফ্লোটো যদি কম হৈ যায় ৰাতি ঘনে ঘনে পেচাব লাগে পেচাব কৰাৰ পিছতো যদি ড্ৰপ কে পৰি থাকে বা পেচাব কৰাৰ পিছতো যদি লাগে যে পেচাব আৰু থাকি গল গুটেখিনি খালি হোৱা নাই so these are the group of symptoms যাক আমি LUTS বুলি কওঁ lower urinary tract symptoms so BPH হলে কি হ'ব পাৰে a lot of people will live with enlarged prostate without any symptoms একো symptom নহয় কিন্তু কিছুমান প্ৰবলেমো হ'ব পাৰে যদি enlarged prostate থাকে we don't take care of it for example হঠাতে পেচাব বন্ধ হৈ যাব কিছুমানৰ these are usually happens to people who are elderly people not younger people so পেচাব হঠাতে ৰখি যাব পাৰে পেচাবৰ ইনফেকশন হ'ব পাৰে urinary tract infection that is UTI হ'ব পাৰে then কেতিয়াবা bladder stone হৈ যাব পাৰে আৰু বহুত rarely যদি আমি neglect কৰো বা proper care নলওঁ চেকআপত নাযাওঁ then sometime renal failure হ'ব পাৰে because of the continuous blockage of the urinary tract so prostate ক'ত থাকে this is the sagittal diagram so ইয়াত পেচাব জমা হয় এটা আমি urinary bladder বুলি কওঁ এইফালেদি মাজেদি এটা ৰাস্তা থাকে this comes all out through the penis এটো urethra বুলি কওঁ তো bladder আৰু এই urethra য'ত penis আৰম্ভ হয় এই পাইপডালৰ মাজত ইখিনি এটা গ্ল্যান্ড এটা থাকে ক্লাসিক্যালি ওয়েলনাট বুলি কয় ওয়েলনাট সাইজ বা তামুলৰ নিচিনা এটা গ্ল্যান্ড থাকে তাৰ মাজেদি পেচাব ওলাই যায় এই মাজেদি so that is the prostate waiting just below as a guardian below the urinary bladder and before the starting of the penis this is the organ so normally সবৰে থাকে এফালেদি পেচাব ওলাই আৰু এটা পিছফালে ৰাস্তা এটা গৈ আছে this is the road পিছফালে এটা গৈ আছে so this road connects to a small reservoir this is the seminal vesicle এটা sperm জমা হয় so সেইকাৰণে penisedi you will either pass urine or semen will come out so this is a junction the prostate is a junction of the urinary tract as well as the genital or the semen tract here এতিয়া নৰ্মেল prostate কেনেকুৱা থাকে যদি আমি আৰু এটা সেকশনত থাকো এনেকে আপেলৰ নিচিনা দেখা গৈছে তাৰ মাজেদি পেচাব আহে this is the road of the urine this is the road Let me check another color. So this is the road urinary passage. So prostate to jita ডাঙৰ হৈ যায়. For example, in this image, you can see prostate to jita ডাঙৰ হৈ যায়. এইবোৰ ডাঙৰ হৈ গ'ল আৰু পেচাবৰ ৰাস্তাটো এনেকে চেপি দিছে. পেচাবৰ ৰাস্তাটো thinner হৈ গৈছে. So this is the cause of the urinary problem, the obstructive urinary symptoms. Prostate to ডাঙৰ হোৱাৰ লগে লগে it not only changes the way of the urine, the passage of the urine through the prostate, কিছুমান changes bladderতো আহে. সেইকাৰণে all the symptoms are not because of the enlarged prostate. A significant number of symptoms are because of changes in the urinary bladder. Urinary bladder পেচাব জমা হয়. So the prostate causes changes not only in the road but also in the urinary bladder. This is a very important slide, but it is a little complicated. So prostate to a single entity নহয়. There are several regions of the prostate. Medically, আমি হেঁতক central zone, transitional zone, peripheral zone, আৰু একদম anteriorly fibromuscular stroma বুলি এটা থাকে. So these are several zones of the prostate. Prostateৰ ওপৰত এটা sphincter থাকে য'ত urinary tract to control কৰিব পাৰে. That is the internal sphincter, just bladder তলত থাকে. আৰু এটা sphincter থাকে য'ত আমি নিজে পেচাব লাগিলে control কৰিব পাৰো. This is the external sphincter. So prostate এটা sphincter মানে পেচাব বিলাক ৰখাই দিব পৰা gate. So এটা sphincter ইয়াত আৰু এটা sphincter তলত. এতিয়া prostate বাঢ়ে কিয় ডাঙৰ হৈ যায় prostate? আমাৰ বডিৰ যিকোনো organ বা যিকোনো টিস্যুত দুটা বস্তু চলি থাকে at any given point of time. So cell যিবিলাক টিস্যু বনায় আমাৰ বডিত, so there is a continuous process of cell death আৰু cell growth হৈ থাকে, নতুন cellও ওলাই থাকে, কিছুমান old cell মৰিও থাকে. So in a normal person, the growth of the cell will be equal to the number of cell dying. So organ to ডাঙৰ হৈ নাযায়. কিন্তু prostate বা ক্যান্সারত কি হয় enlarged prostate cell proliferation যেটো cell মানে growth হয় it will increase a lot at the same time the number of cells which are dying will decrease. This will cause the enlarged prostate. আৰু ক্যান্সারত কি হয় ইমানে স্পিডত cell মানে increase হয় proliferation হয় and the cell death is somehow it is sabotage. So the number of cell death is really less and the cell proliferation is very high. It occurs in an uncontrolled manner irrespective to the surrounding tissue. এনেকুৱা যদি হৈ যায় তেতিয়া cancer হৈ যায়, cancer of the prostate or any other organ. This is the how the cancer occurs. But in enlarged prostate, this is not a cancerous condition, it's a benign condition. So ইয়াতো cell proliferation বাঢ়ি থাকে, cell multiplication বাঢ়ি থাকে, কিন্তু cell death কমি থাকে, but not as rapidly as in cancer. Now মই আগতো ক'লো যে as the age increases, so this is the axis of the age, this is the prevalence of the histological presence of BPH. যে আমি ক'ত দেখা পাওঁ কিমান increase হৈ থাকে BPH or incidence population of BPH around 30 years or লৈকে almost 20-30 years or লৈকে it is almost normal only. After that age slowly বাড়া বা proliferation আৰম্ভ হয়, slowly তাৰ cell growth বা number of cell in the prostate starts increasing. By the age of 80 you will see that almost 80 to 90% of the patient will have some evidence of enlarged prostate histologically. So clinically আমি কওঁ যে around 40 to 50 পিছত আৰু আৰম্ভ হৈ যায়. This is a low curve, then sudden exponential growth হৈ ফালে and then BPH বাঢ়া আৰম্ভ হৈ যায়. So most of the people who come to us are here, they come in this age group with lower urinary tract symptoms, পেচাবৰ problem লৈ আহে. আৰু এতিয়া দেখা পাওঁ যে বহুতে আল্ট্ৰাসাউণ্ড লৈ আহে enlarged prostate দেখা পায় this age groupত, they become really worried and come to us. This is the prostatic weight. Prostatic size to কেনেকে বাঢ়ি যায়. This is the age of the patient and then this is the prevalence. So লাহে লাহে বাঢ়া আৰম্ভ কৰে up to the age of around 40-50 slowly থাকে, অলপকে বাঢ়ি গৈ থাকে. but then suddenly it start increasing in the size. So as the age of the patient increases, the weight of the prostate also increases. It is quite is a easy inference. আমি previous slide to দেখিছো যে histologically যে স্লেন নাম্বাৰ বঢ়ি যায় বাঢ়ি বাঢ়ি গৈ থাকে তেতিয়াহ'লে সাইজো বাঢ়ি যাব আৰু weighটো বাঢ়ি যাব. By the time of 80 years almost 40% মান মানুহৰ weight significant বাঢ়ি যায়. 40 to 60% weight বাঢ়ি বাঢ়ি গৈ থাকে. This is the prevalence in gram. So up to the age of 80 years, 40 to 50 gram, most of the people will have this amount of prostatic weight. Now, is it common across the world? India silo, this is the yellow curve, that is the India. Here you can see the how common Indian population of amar BPH thake. These are for several other countries including USA, England, Denmark, Australia, as well as Japan. Ejor logot kiman মানে BPH by enlarged prostate bari jabo pare. So the trend for all the countries are almost same. This is the average for all the country combined, and these curves where it falls. So individual countries are shown in thin lines. So for India, that is the yellow line. You see, even in India or the other country, there is a common trend that as the age increases, the prevalence of the enlarged prostate also increases. যেতিয়া prostate to enlarge হৈ যায়, the speed of the urine flow decreases. Obstruction কৰি দিয়ে, ব্লক কৰি দিয়ে, যিহেতু পেচাবৰ ৰাস্তা তাৰ মাজেদি যায়, পেচাবটো ব্লক হৈ যায়. ব্লক হলে কি হয়, যিটো মেক্সিমাম স্পীড থাকে বয়সৰ লগে লাহে লাহে কমি থাকে. This is the age group and this is the peak flow, যে কিমান স্পীডত থাকে. At the age of around 40, 45, most of the people will have more than 20, 25 মান স্পীড থাকে. স্পীড ইজ ইন ml per second, কিমান স্পীডত পেচাব কৰে. যেনেকে এজ বাঢ়ি বাঢ়ি গৈ থাকে, the speed also decreases. By the time the patient is around 75, 80 years, the speed to around less than or equal to 15 মান থাকে. So as the age increases, the speed of the urine decreases, mainly because of the enlarged prostate. So prevalence of BPH and clinical manifestation सिर्फ স্পীডে নহয় আৰু বহুত symptoms থাকে, lower urinary tract symptoms মই যেনেকে কলো. So here you can see the same extrapolation of the previous slide. As the ages increases, the prevalence যে কিমান মানুহ থাকিব চবৰে নহয়. For example, a person who is 40, in between 40 and 50 years, if I take 100 people, around 14 people will come with urinary symptoms. কিন্তু এটা মানুহ যদি around 80 years হৈ যায়, 40% of them will have some symptoms, clinical symptoms of enlarged prostate, and the rest of the 60 or 50% will not have any symptoms, but still they will have enlarged prostate. And if we evaluate with investigations, we might find a lower peak flow. So I hope you got some preliminary introduction to enlarged prostate and what it can cause, symptom bila ki hoy, and how common it is. It's a normal aging process phenomena. Almost all of us will have some urinary symptoms by the age of 80 if we are lucky to live that longer. And take care of your urinary tract, take care of your prostate, and if you're above 50, seek medical help to find out what is happening to your prostate. It is a part of the general examination or a health checkup for an adult male. Ask for a PSA test, maybe for a uroflowmetry and ultrasound and serum creatinine, and the most important test is to do a serum PSA examination. Thank you.